Get ready for a no BS approach to health and fitness. This is NBS Fitness Radio.
All right, welcome back to MBS Fitness Radio. I am here with Dr. Brad Langley. Dr. Langley is a doctor of physical therapy. He also is an athletic trainer and has a CSCS, and he has been practicing physical therapy, sports medicine for over 15 years here in the Memphis area. And Brad came on. We got connected because a mutual friend was seeing Brad for what he thought was some just general physical therapy stuff, but actually needed something a little bit outside, or maybe something a little bit different. And we were talking about this earlier, and we called neurodynamics. So, Brad, to open it up, what is neurodynamics?
Oh, that's a great question because it is a fancy word. So basically, in short, it's basically how well your nervous system moves. So we think of the nervous system, maybe it's just like this stationary thing that controls stuff, but it's kind of more like soft tissue. The same way we need our tendons, our muscles to slide and glide, then we need that nervous system to do that as well. And so
Interesting.
it can get entrapped and things like that, which will lead to some problems down the road. So that's probably the easiest way to describe it.
Okay, now is that both the central and the peripheral nervous system?
Yes.
Okay.
Yeah. So generally speaking, when we think of neurodynamics, we think of the peripheral nerve. So you might be an easy example would be like a pitcher who gets owner neuritis. He's throwing, 90 pitches a game. The nerve gets a little bit irritated, so it's not sliding well through that groove, and they'll get some numbness, tingling, things like that. So that's a really easy example. Or like a carpal tunnel would
Yeah.
kind of fall into that. But yes, centrally we can see that the central nervous system, the spinal cord itself, does need to have some slide and glide within it.
Now, two questions to that. One, what would be the symptoms? Like, what would someone feel if they didn't have proper neurodynamics? And then secondly is what would cause improper neurodynamics?
So if we're talking peripheral neurodynamics, again, you'll get some isolated symptoms like the numbness in your hand or something like that. And so that you might be, oh, I think I got carpal tunnel, and then you can kind of trace it back. Well, actually, it's not carpal tunnel. It might be entrapment at the ulna, or it might even be a brachial plexus type thing. So you can have symptoms like that. Same thing in the legs. You can get some numbness, tingling, weakness. A lot of times is a thing. So that's kind of more the peripheral side. So as you move centrally, that's when the symptoms get kind of all over the place. So those are the people that I guess probably easy example would be just this insidious low back pain.
Mm.
It's like, sometimes it hurts, sometimes it doesn't. Sometimes it runs down my leg, sometimes it doesn't, or whatever. And you'll find that it's just centrally that system is basically gummed up. And there's all sorts of cool techniques that we can have to kind of restore some of that slide and glide and basically teach that system how to regulate itself back to a little bit more of a homeostasis, parasympathetic nervous system.
What would cause an issue?
A bunch of stuff.
Okay.
So again, the easy one would be like some kind of injury.
Yep.
Obviously, centrally, man, car wreck. That's a really easy example. You get a whiplash injury or something like that. Obviously, we're going to have trauma to the brain, to the spinal cord, all that. So that's an easy and kind of an obvious one.
Right.
The weird stuff is where we're dealing more kind of maybe it's an emotional or some kind of like stress at work. I got a
Mm.
couple of patients right now that's kind of the situation they're in. They just came to me with they're like these weird symptoms. Nothing really follows any pattern, and they're just like, we don't really know what else to do. So they just kind of show up at my door and saying, "Hey, somebody said that you do stuff like this." What we find is they're just so stressed. Like
Yeah.
they wake up stressed, they go to work, they're stressed, they come home, they're stressed. And it's just a new job. There's a lot of going on. Maybe something happened in the family. Maybe you're going through a divorce. Maybe you have a kid who's sick, things like that, which are really tough. The nervous system is still having to regulate all that stuff as well. It kind of doesn't really know the difference between kind of physical stress or emotional stress. Stress is stress.
Yeah.
So it has to try to regulate that.
So if you're going to help someone kind of diagnose something in that area, is it that, hey, clearly, like I did this started to hurt. Like
Right.
that's a clear, like, hey, musculoskeletal injury or something, this thing's been this specific thing. But I guess for like some of the central issues, is it typically like my lower back is constantly hurting, but I can't figure out why, and nothing seems to like, or is it like, t- is it just kind of pop up in different places? We'll be like, man, my lower back kind of hurts here, then like my shoulder and my chest, and like
Yeah, it pops up all over the place, so sometimes it manifests as pain, so again, if you had some kind of trauma, it's easy. Yeah, I had this trauma, it had low back pain, and then my central nervous system, the regulation kind of got out of control, and I still have some problems there. um so it could be a pain issue, it could be a weakness issue, it could be like a quality of contraction. So one of the patients I have right now, like the big symptom is that like if he does a knee extension, it just like it shakes. Like
interesting. Yeah,
no, he's like, there's nothing wrong with my leg. It's just like boom, and it gets that tremor, and he comes in and it's the tremor increases when his stress increases, and then we do some regulation, and the tremor starts going away. Sometimes it's headaches, a lot of GI issues. So
yeah,
the vagus nerve is the big controller for us, right? That's kind of a big thing right now. A lot of people talking about the vagus nerve, but it's an interesting nerve because it's one of the 12 cranial nerves, comes right out the base of your skull, and it runs basically the length of your system, the length of your spine there. And it's got all these branches coming off, and it's really interesting because it's really one of the main nerves that are monitoring what's going on with your body, right? So it monitors what's going on with your body and then kind of controls what it needs to do. So like, what's happening? Am I in a safe place? Can I relax, or do I need to ramp up and fight? So it's going to control that sympathetic parasympathetic movement, right? And so what we see a lot of times is when this vagus nerve, what we call the vagal tone, we have decreased vagal tone, that's a bad thing. Increased vagal tone, that's a good thing, because we want the vagus nerve activated. When we see that vagus tone get dysregulated, it manifests a lot of times in like GI issues. Because
interesting.
if we're dysregulated, we're in the sympathetic nervous system. We're in that fight or flight all the time. Like, am I in a safe place? Am I not? And if your body doesn't feel like it's in a safe place, it feels, maybe it is some kind of injury that it just can't get over. It's like, I feel like I'm being attacked. Well, it's not going to shift down and allow your digestive system to do its job. So these are the people that, man, I ain't been to the bathroom in a couple days. You know what I mean? Which is a whole laundry list of problems in itself.
Which, yeah, it's interesting because being in the fitness world and dealing with people who are trying to overcome health issues all the time, so many people are dealing with gastrointestinal issues. But
Yep.
their first trigger or thought is probably not like, I should go see a physical therapist.
Right. Right. And
Um,
it's weird to have those conversations like, hey, when's the last time you went to the number two? Like, wait
right,
a minute, I'm here for my shoulder.
exactly. Um, did you say sleep as well?
Sleep, yes, of
Yeah,
course, sleep. Now, I mean, that's a parasympathetic thing. If we don't feel safe, that's probably the easiest way. When I think about it, when I see a patient, that's kind of the question that I'm always asking myself as I'm going through an exam. Like, what are the body functions that occur when you feel safe? So that's the sleep. I mean, even just like the way you feel when you're at home with your family and everything's safe and good, like just that feeling that you have,
yeah,
like that's what we're chasing. And so then as we look at these symptoms, like what could be causing that body, that system to feel unsafe to where it
yeah,
can't relax or whatever. So that's kind of the way to make my head a little bit more simple, is looking at that. Hey, what are the things that happen when we're safe and relaxed? So that's
yeah,
all sleep, the digestion, all that, the healing,
yeah,
the anti-inflammatory aspect of our hormonal system. That's not going to happen if we don't feel safe.
right. Yeah. So that's probably why to define for people what the parasympathetic versus the sympathetic nervous system is.
So parasympathetic system is what we call the rest and digest. So it's the kind of, think of it as the regenerative, if I can speak, the regenerative aspect, right? So our nervous system will shift into this when we want to repair and grow and sleep and all that stuff. So it's the rest and digest.
Yeah.
Sympathetic, fight or flight. That's the heavy cortisol, like we're in it, we're about to go do something. So yes, we're going to shift in that when we're going into a workout. We're going to shift in that when we're had an argument with our spouse. We're going to shift in that when I'm about to go into a meeting or something like that. And they're very important. Obviously, it's not like, oh, I only want to be in parasympathetic. No, that doesn't work. We have to be able to go to both. But the problem that a lot of us have, probably more so than we realize, that even with injury or without injury, we have a hard time bouncing back and forth between those two.
Right. Yeah, for sure. So maybe talk a little bit more about why that is. What makes us unique in that we have such a difficulty, or maybe not a difficulty, but that we spend so much time in a sympathetic state.
Well, we're go-getters. And that's the thing, just culturally, you're looking at a highly driven people.
Yeah.
And so, and again, not saying that's a bad thing, but we just got to know how to regulate. And that's, I'm sure we'll get into that later. But you look at people that, hey, I'm going after that promotion, or I need to get this thing done. Maybe I'm an athlete, and it's like, yeah, I'm trying to make the varsity team. I'm trying to go to college. Like, it's drive, drive, drive. Everything's drive. Everything's like very, very high intent. I have one singular goal.
Yeah.
Which is, again, it's fine, but what it's going to do is increase our cortisol levels. It's a very focused. It's a fight. You're going into a battle to win, and so you see, kind of culturally, I mean, that's kind of the way we are as Americans in general, and we just have a hard time. It's like, yeah, it's okay to just rest. Oh no, you're being lazy, or no, I don't have time for that. I mean, look at the parents out there whose kids play soccer. Like, I'm going to a soccer game right after this. I got a soccer tournament after this. So it's like, okay, I just got off work. I got to get dinner ready. Oh, we got soccer practice. We got a soccer game. I got one kid over here, but then the other kid's over there. You're just going nonstop.
Yeah.
And you're going to be in sympathetic nervous system when you're like that. You got to find some kind of time to slow down, to stop. And that's hard. That's hard to do.
Yeah, for sure. We have a culture of a driven culture. We have a culture of more.
Right.
Pros and cons of that. I said I like my iPhone just like that, like everyone else likes their iPhone. And we're constantly inundated by what could be. One of the things I watched the other day was a dude who lived in Siberia, and it was -91. I was like, I can't even fathom how cold that is.
Oh, that'd be
But
awful.
he lived in a cabin with cellophane plastic windows. So basically, he had to cut wood and burn it all day to not freeze to death. He's like the most grateful, happy person. And I was, considering why. I was like, well, every day he is exposed to what could be on the bad side of things. Like, I could be bare food, I could be frozen to death. Like, any day I'm not dead is a good day.
Right.
And for us, we're just constantly exposed to what could be better. Oh, I could be making more money, or I could be better at soccer. I could be driving that car. I could be more ripped, or what? We're just constantly exposed to all these things. So we have a driven culture and a busy culture, and then on top of that, like, there's no capacity for life to happen, and life's going to happen.
Yeah.
You're going to lose a job. You're going to have a schedule change. The kid's going to get sick. You're going to lose a loved one. Life's going to happen throughout your life. And when you don't have any capacity in your life for life to happen, that's when, like, you're already stressed, and all this sudden, boom.
Right. Yeah, that's a great way to put it, in the idea of capacity. It's like you said, we're just redlining all the time. So
You're already
I got no wiggle room here. I got no elbow room. So like you said, when one thing goes wrong, it's like, man, everything's going to fall apart. The dominoes just start going. And then, like you said, boom, now there's stress upon stress. and now we're just getting out
Yeah.
of control.
And so when we have that consistent stress, our body doesn't have the time to rest, digest, repair. And then over time, that's going to manifest itself as physical dysfunctions.
Yeah, you get, I mean, mood changes, physical dysfunction, all that stuff. That, those are the people. I mean, you run into them, it's like, man, that guy's in a bad mood every time I meet him. It's like, well, it turns out, yeah, he's working 80 hours a week. He just doesn't have time to have a little bit of rest and digest time.
Yeah. And I would even argue, like, I was just thinking about this as a parent. Like, I got 3 kids, and come home and like we play and we eat dinner and you do all this stuff, and like there's often this when I do find myself with like a little bit of space, I'm like, where's my checklist? What am I supposed to be doing? It's like, no, I can, all right, I can sit down and chill. Okay, this is kind of nice.
Right.
They
Right.
almost,
It feels
uh,
weird.
you get such few chances to actually just truly rest that when you have one, you're like stressed because I feel like I should be doing something.
Right. Yeah, you almost feel like you're being lazy or something. Again,
Uh,
that's that productivity monster that gets you.
Yep.
And that's the thing that we see, kind of again from a physical therapy standpoint or a coach's standpoint, you see these kids that are overprogrammed. Same thing. Like I'm playing 2 sports, I got this test, I'm in this club or whatever. And so it's easy for us to overprogram ourselves because we're trying to, do what we do or whatever. But the but again, you see it happening at a very young age to where it's like, yeah, your intentions are great. You want them to get the head start or whatever, but it's okay to have, what we call scatter focus, where you have free space
Yeah.
to allow your brain to go into la la land if it wants to, or
Yep.
find what it's interested in or whatever. Just it's bad. You have to program the non-programmed time.
Yeah. I often consider that it's like what are our kids seeing adulthood is like? Because like they're probably seeing adulthood as, oh, this is just this period where you're just stressed out all the time and go go go, and doesn't and the only form of like enjoyment you get is like through alcohol or food. And you know like if I was a kid, I'd look at that and go, well, I definitely don't want to be an adult.
Yeah, right.
you know and then we essentially place that same um mindset on them, just with a slightly different focus we call sports
Right.
and school. And then we're kind of like conditioning them to be stressed out adults because we're making them
Mhm.
stressed out teenagers.
Yeah, you're absolutely right. It's kind of crazy when you stop and think about it.
For sure. What So how do you then address the vagal nerve, and what are some ways like help people down regulate?
So again, like basically all the symptoms that we typically see when you come in. So you come in, you're a physical therapy patient, I hurt my shoulder, whatever it is. You come in, all the pain, limited range of motion, all that stuff, all those impairments, what we would list as impairments that they come in with, you can see those as, hey, they are going to throw you into the sympathetic nervous system. All right. So kind of the first thing, and took me probably longer than it should have to really appreciate that with with my patients, that, hey, man, they're in a sympathetic nervous system for a lot of different reasons.
Yeah.
And so, and even in the environment, that's kind of the white coat syndrome or whatever. They
Yeah.
come in and, hey, am I trying to make them feel safe?
Yeah.
It's like you're coming in this weird space. A physical therapy clinic, sometimes it's big. There's a lot of stuff going on. Maybe you're at the gym and you got a new client coming in, and maybe they have some issues. Oh, I got a history of low back or whatever. But I'm also in this new environment where people are like deadlifting and like that dude just dropped weight. Last time somebody dropped a weight, something crazy happened or whatever. And
Yeah.
it's just like the first way to address that vagal tone, again, it's just, do you feel safe? Is this a good, safe place to come?
Yeah.
And so that, as a clinician, as a coach, it forces you to slow everything down. Instead of being like, hey, come on now, I got my next patient coming up, blah, blah, blah. And that's kind of the way we get going a lot of times. And it's like, man, you were just, when you act like that, it just, to me, pushes them into more of that sympathetic. Is only going to make your job harder. It's only going to make getting the range of motion more difficult, right? So to put it very simply, to start, where do you start? It's like, is it safe? Make them feel safe, make them feel welcome, all that. It's kind of cheesy as that kind of sounds. Like they say that in PT school, make the in. And I kind of like, yeah.
Yeah.
But man, there's actually a lot to that. So there's that. Of course, you're going to go through your normal exam. You got to look at your neurodynamics. There's all these tests to see, hey, what's happening, what kind of symptoms they have with the range of motion and different things like that. But then we're going to get in a lot of, from a physical therapy side, when it comes to the neurodynamics and improving that, there's a lot of hands-on things. So it's a lot like myofascial release, right? So if we're
Yeah.
going to go in there and do the myofascial release and get that fascia moving, we're going to use basically that same kind of technique to really promote that neurodynamics. Because of course, everything's wrapped up with fascia, right?
Yep.
So nerves are wrapped up with fascia, bones, muscles, all that stuff, right? So when we're talking about just the mobility of the system as a whole, we kind of use the same techniques that we would for, a fascial release over the quad or whatever, right? But we just got to go through and just really follow the tracks of it. And so and sometimes it's just simply decompression. You know, Again, what we're trying to do when we're talking about vagal tone regulation is we want that system to feel safe.
Yep.
And so again, I'm gonna say that probably 1,000 times because literally that's all I'm thinking when I'm treating a person is I'm gonna do something and it's like, well, does the system feel safe right now? Okay, they don't feel safe right now. And sometimes you don't want them to feel safe because we need them to adjust or whatever, but we always want to come back to that.
Yep.
And I've had patients before where it's simply just positioning, like teach them, hey, how do you're beating yourself up. You're sitting like this all day long. And it's like, man, you're beating yourself up. Let's just spend 30 minutes of figuring out how many pillows do we have to have? We got to get 32 pillows to brace everything up so that, oh man, now my vagus nerve comes right out my skull down to my neck. It's like, well, if your neck's like that all day, then you're dysregulated. So
Right.
simple, that's kind of where we start. And then, like I said, when we go into treatment, there's all sorts of cool techniques that manually that we do, and then there's exercises to promote the nerve mobility and things like that.
But yeah, that's what are some of the other treatments?
So there's like just like you would stretch a muscle, right? There's positions where you put a nerve on slack or tension, right? So if we're doing peripheral nerve dynamics, so again, ulnar nerve's the easy one, right? When I bend my elbow and then put my wrist back like that ulnar nerve that runs down kind of, I don't know if you can see it, runs down the outside of my hand right there, or that would be the inside of my hand technically, the ulnar side of my hand to my elbow, that's going to put it on tension.
Yeah.
So if that ulnar nerve doesn't have the neural dynamics, the ability to slide and glide, I'll put you in that position, you're going to be like, oh, I don't like that. Or my
Yeah.
pinky finger just went numb. Like, boom, I just lost my pinky finger, you
Yeah.
know? And so then what we're doing is we're going to play within that safe space. Like I want to find that limit right there. And just like if I'm on a back squat, I want to find your limit, and then we're going to step you up. And we work on some mobility activities like that. A lot of it could be some strengthening stuff. Again, the shoulder is really easy because it's like, hey, is my rotator cuff stabilizing that shoulder for me so that the nerve can slide and glide through that track? Now centrally, there are some, so you get like lower trunk rotation and things like that actually get the whole nervous system to kind of slide and glide. So there's some techniques like that.
Is
Uh,
there what's maybe the benefit to stretching it versus I can't remember what the word to use, but slack creating slack within it.
and so generally speaking, like the nerve itself doesn't really like to stretch, right?
Yeah.
So like a muscle, we go one end and the other end, we'll stretch it, and it
Yeah.
creates length, and then pew, it's like a rubber band. Like we get attributes from that, right?
Yeah.
The nerve doesn't really do like that. So the nerve has a natural slack built into it,
Got it. Okay.
right? And so the neurodynamics refers to just the ability to slide one way or the other. So you can create tension on one end and
Yep.
it'll kind of slide down there. and then come back the other way,
Yeah.
And so again, like, hey, if I'm doing that number right there, I'm pulling my ulnar nerve down toward my hand, and then if I release it, it slacks back up.
Okay.
Now, technically, you can tension on both sides, and there's a time and a place to do that. But generally speaking, it's more of just, hey, we want that system to slide and glide.
Got it. Okay. What now what other techniques would you use?
So again, if we're talking, going to see a physical therapist, hands-on stuff, especially when it comes to like vagal tone, we see the vagus nerve, of course, is a cranial nerve. So it comes out the base of your skull, runs parallel right with the carotid artery and the jugular vein. So it runs right there underneath your ear. So it's fairly easy to kind of palpate that track. But what we see a lot of times is that upper cervical spine, because we're kind of sitting there all slouched with a chin out, right?
Yeah.
The upper cervical spine will get compressed anterior, and it'll actually kind of pinch on it right there. So you almost get like an impingement right there. And so kind of low hanging fruit, let's go in there and make sure we got some mobility through that C1, C2, C3 area and get a little bit of that just kind of traditional cervical mobilization. It's just to give it a little wiggle room. And then again, we'll follow that track, doing more of like a myofascial release.
Okay.
Really easy. And as you run down and you'll feel like, oh man, there's a sticky spot right there. Maybe the patient's like, whoa, what's that? Things like that, loosening that up. Obviously it has a branch that comes off and it addresses the larynx. So like our voice, there's exercises with our voice that, as silly as it sounds, like, hey, changing the pitch of that and getting your voice box to actually do stuff. You can actually wiggle your larynx back and forth like that. And you might find like if you and then move it over, it'll like kind of cut off a little bit because you're tensioning that
Huh.
branch of the vagus nerve right there. And so there's exercises to loosen that up. Um,
What are the voice exercises?
So just like that, just like a lot of it's more of so
Moving.
like you move it. It's hard to do it and talk at the same time, right? So
Yeah.
you're moving your larynx right there. So as I'm talking, you can hear as I push over there how I start cutting off,
Yeah.
right? So then it shouldn't really cut off that much,
Yeah.
right? So in my work day, I'm probably a little bit stressed. So we'll come through and like clean that up right there and give you a little bit more slack in
Yeah.
that area. And then we'll come back and be like, oh, look, all of a sudden I'm talking better, you know? And so that there may be some tension right there, somebody that you talk for a living, oh man, I get a lot of restriction right in there, which
Yeah.
leads to dysregulation downstream. We can do that. There's a lot to do with like the soft palate, and that gets a little bit more in kind of the dentistry world. There's some, what do they call it, like myofunctional therapy or whatever they call it, where if the soft palate's too high, technically we can mobilize the soft palate and try to open it up a little bit. So especially little kids where their soft palate's really tall,
Yeah.
they're going to be mouth breathers. And so if I'm a mouth breather, again, I'm changing the whole posture of my head and neck, as well as some of the deep neck flexors right there. They're not working the way they're supposed to. So now I'm in a bad position. So we actually come in and do some tongue exercises, like holding the tongue to the roof of your mouth, like things like that. There's again,
So
just
there's manual release techniques for the upper palate, for the soft palate, or,
yeah.
or kids that oh man, that's super interesting.
Soft palate is pretty soft. And I mean, even as an adult, like you can get in and just kind of try to spread it out a little bit.
Yeah.
And you'll notice the difference. Like, oh man, that is a little bit wider, and it might creep back up on you. Um,
Same. I read the book Breathe.
yeah,
Yeah. And all about soft palate development, open up those sinuses. And yeah, I was aware that like soft palate could still be developed, but I never considered like actually doing manual therapy to it to stretch it out. Interesting. Okay, that's cool.
yeah,
Uh,
it's cool. I try not to do that. I don't really want to be in people's mouths. So like, I kind of like, hey, if you want to work on this, like do that. I generally stay away from that aspect of it. I do it on myself, and I'll do it on my son
yeah,
sometimes or whatever. But yeah, that gets a little bit weird because you're in somebody's mouth. So, but
I've
yeah,
done.
you do that and just basically work your way down.
Yeah, I've done the Rolfing 10 series twice,
Hmm.
and getting the whole sinal
Yeah.
release when someone sticks their finger in their pinky finger up to your nose to their knuckle, stretching out your sinuses. Like, this feels weird.
Yeah, that's a lot.
I was like, this is I just can only assume this is as awkward for you as it is for me.
Right. That's your only hope.
Yeah, that's just this is my favorite part.
Yeah,
I love.
those people that like that, you're like, I don't know about this.
Um, what about breath work? Y'all incorporate much of that?
Yeah, so that's the easiest way to regulate the vagus nerve. So that's kind of the go-to. So when it comes to like homework, making long-term changes, at least that's my go-to. Maybe there's some others that may be better at it or do different things. But again, if we look at the vagus nerve comes out the base of the skull and goes all the way down to your guts, right? And so what we're looking at, the mobilization, that slide and glide of that vagus nerve, it's lengthening and shortening. That's going to be driven by our diaphragm. Does the diaphragm drop down? Does it come up? And that kind of stuff.
Yeah,
And so the easiest way, if we have a dysfunctional breathing pattern, it's like, yes, the vagus nerve is going to be dysregulated. It is designed to have that a little bit of a rocking effect, kind of like rocking a baby to sleep.
yeah,
It's designed and integrated with that diaphragm to feel that lengthening and shortening, lengthening and shortening. And again, if we're sympathetic, what do we know? We know that our breath rate gets faster, our breath gets shorter, and things like that. And so if we get a dysfunctional breathing pattern where our diaphragm doesn't really know how to pull all the way down, or we don't know how to fully exhale. Exhalation is one that's like really challenging. We don't, I've found that we don't breathe out all the way. We really shortchange ourselves on exhalation. Um, and what we know is when we fully exhale, our heart rate slows down. And if our heart rate slows down, what are we doing? Maybe I'm drifting more toward parasympathetic versus if I have I'm breathing more in the upper lobes. I'm not fully exhaling or whatever. That heart rate's going to stay up. And
yeah,
so, again, that's just one of the things that we see those dysfunctional patterns where, man, we're getting stuck in sympathetic. And so breath work is kind of that's my go-to. And that's very challenging.
yeah,
Like breathe a bunch, it's supposed to be an automatic thing, but it's very, very challenging. So that's kind of honestly, most of my homework that I give people is dealing with breathing, getting them
yeah.
to breathe, actually use their rib cage. I'm not a big fan of like belly breathing.
Mm,
And I don't think it's necessarily wrong. I just think maybe we misunderstand it, or maybe I look at it slightly differently. But a lot of times we get into like belly breathing. And I understand the concept that we're trying to use that diaphragm and pull down and everything. But if you really belly breathe, you like your rib cage doesn't move.
yeah, yeah.
And I need my rib cage to move.
Right.
Like if I can get that rib cage nice and wide, so we really almost need to be breathing to like the bottom edge of our rib cage more so than our belly, right?
Yeah, yeah,
It's
yeah,
probably easier to breathe to your belly because it's kind of soft down there. But honestly, if we create a good pelvic floor base and lower abdominal base that actually creates a little bit of firmness in that abdominal wall, and then we breathe, it's like, oh, now my ribs are starting to move.
yeah.
And again,
Yeah,
that regulates us a little better.
yeah. I wonder, like, if the belly breathing was kind of like the pendulum reverse of like upper thoracic breaths.
Right.
It's like, well, you're you're using no diaphragm, so let's like
Right.
I can like shove it as far down as possible. Um, but what's the cue that helped me, and I just found it has helped me coach other people is more like I want you to fill this whole cylinder
Right.
from the bottom up. You know, this isn't like just breathe into your belly. To take your biggest breath possible, you're going to have to engage both your diaphragm and all your upper, respiratory muscles. So fill
Right.
it fill the cylinder from the ground up. So that helps them kind of like engage the pelvic floor, breathe it up all the way up and kind of expand everything. But yeah, man, it's so interesting how something as simple as breathing is basically done incorrectly by pretty much everyone, unless someone has taught you how to breathe. And it sounds crazy, but it's just like I can guarantee you're breathing incorrectly. Because if
Yeah.
nobody ever
Honestly.
taught you, then no, then I can promise you you're breathing wrong.
And especially if you're coming off of some kind of trauma or something, that's where you see it in like low back patients big time.
Yeah.
Because obviously low back, man, there's so all the postural muscles, all the stuff, right? When your back locks up, you're done. You can't move. You're definitely not going to breathe deep. You get that shallow breathing or whatever, And we see that those postural muscles that are associated with low back also play such a big role, almost in like accessory breathing muscles as
Yep.
well.
Yep.
And so now all of a sudden I got a dysfunctional bracing pattern. Like, well, I can't breathe if I can't brace right.
Right.
And I can't brace right if I can't breathe right. So now I'm stuck.
Yep.
And that's kind of where I see a lot of people with the dysfunction. And it's if we can get, like I said, if you can get them just breathing just a little bit better, it's crazy oh my gosh. I'm like, oh, I can take a nap,
Yeah, right. Right.
It's like they just relax.
I can sleep and okay, that
Yeah.
was help and yeah, 100%. Um, what? So we had the mutual friend who was having some lower back issues and kind of backstory, just had insanely stressful whole entire year. What were these the techniques you used with him that he was like, that was weird? What did you do?
Yes, I don't even think we got to that, to be honest with you. So the first one was a little bit of just more the manual therapy stuff. And so the idea was like, hey man, I just got to give you some slack. You know, when you get wound up like that, like you're saying, you had some low back issues. That's going on or whatever. But then I'm stressed out too. You're stressed out. I'm all in my upper traps. Like, I can't do anything. So with him in particular, we really just start off. Hey man, we got to give you some kind of slack within your system. You
Yeah.
know, um, obviously, when you're stressed mentally, like it's hard to give yourself some slack when you're super stressed, but it's like physically, we could give you some slack though.
Yeah.
You inside your brain, you're still going to be stressed, but can we create that safe space again? Can we give you some slack where there's not tension, where you feel like you're being pulled in all directions?
Yeah.
And that's kind of way when I think of like the vagus nerve from a physical aspect, what does the vagus nerve feel like? I think about all those times where I feel like I'm being pulled in a thousand directions.
Yep.
And I'm just super stressed. And I'm like, man, I feel like everybody wants me to do something. I got no time to do anything. Well, if we look at all the tightness and the dysfunctional breathing pattern and muscle spasms, guarding, myofascial restriction, all that stuff, those are those stressors that are pulling that vagus nerve in a
Yeah.
thousand different directions. So it's like, man, let's get rid of some stuff.
Yeah.
Whatever we can dump off onto a coworker, let's dump it off on a coworker,
Yeah.
And so a lot of just myofascial release going through, especially through the diaphragm. And what we see is we get really restricted. The way I always try to think about it is, again, imagine that we're being pulled in all directions. So imagine that vagus nerve runs straight down the middle of right by your spine, and it's being pulled laterally. It's being pulled to the outside.
Mm,
What I want to do is try to centralize everything. So I basically start on the outside and create slack. So
yeah.
that's your QL, your transverse abdominis. You're going through the ribs and things like everything that's like wide here. Well, let's
Yeah.
start loosening it up. And yeah, we may still be tight centrally, and there's some, yes, we need to try to release that a little bit, but just all that stuff that's hanging on to the end and pulling you like where you're like, oh, I'm stretched so wide and
Yeah.
about to lose it. That's kind of in my head how I organize it in my brain. And that's how I organize the treatment. And that's what I did with him. It's just like, hey, let's just give you some slack somewhere. You are clearly being pulled in a million different directions, psychologically, just with the stress, but physically, because he's still trying to work out. It's like, I still got to be fit. I don't want to lose my fitness. And so now, oh, it's just, man, give you some slack somewhere.
Yeah. Yeah. Are there ways that you guide people to have some self-awareness of their neural state? How can I check if I'm more parasympathetic versus sympathetic? Kind of in my general state.
Well, probably the easiest way from like an electronics is your HRV. So HRV is kind of a very objective way to do it, because everything else, it is very hard to objectively quantify this.
Right.
That's probably why not many clinicians touch it, because it's kind of, if you can't objectively quantify it, then no clinician really wants to touch it. you know, you got to
It's
justify it, blah, blah, blah. Anyway,
hard to bill. It's hard to bill for
you
that.
got it. That's it. With no objective data, you're not getting paid. So, so HRV is probably the easiest way,
Yeah.
and there's so many devices out there that monitor that. And so, HRV is a really easy way to check it. So, hey, get up and check your HRV if you're high or whatever. Hey, we're as long as we're tracking the right way, and you can, I mean, honestly, you can probably do it. The next time you feel stressed, do a quick check on yourself, see where your HRV is. I bet it's going to be lower than what it normally is.
Yeah.
Sleep quality is another one. It's just, how many times you're like, oh man, I just didn't sleep well last night.
Yeah.
Well, we have to ask the next question is, why didn't I sleep well last night? And most time, because I do the same thing, it's like, oh man, I slept like crap last night. I feel terrible. And then you just go on about the normal routine.
Yeah.
Like, no, something messed you up. Was it the cat? Maybe it was caffeine, maybe some kind of stress or whatever. And so monitoring that sleep. Hey, what is the quality? What's the length of time? I have a patient right now. She's really good because she doesn't sleep good. She's like had a crazy medical history with a tumor on her spine and all this stuff. So her nervous system is all sorts of all over the place. It's
Yeah.
it's kind of like you never know what you're going to get. But she doesn't sleep much, and so it's really easy when I can get her a little bit more regulated. Man, she goes from 3 hours of sleep to 4.5 hours of sleep. Oh, okay, we know we're good, and it starts
Yeah.
creeping down. Those are easy things. As kind of gross as it is, like, how often are you pooping? I
Yep.
mean, like, it should, somewhere about that kind of 16 hours is the average that it takes to clear your system. And
Yeah.
if you're going 2 days, 3 days, like something's a problem.
Right.
Um, Things like that. It's really speaking of like the voice and stuff. Like if you look at the uvula, when you look down your throat, say that, you'll see if it's a regulated vagus nerve, it'll go up nice and high. If it's not, it doesn't go as high. And so,
Interesting.
yeah, it's really interesting. That one's kind of one of the weird ones.
I have not heard that one before. Yeah, that's new.
Yeah, yeah. So you kind of have to, shine it down down there, and you'll see. Oh man, that left one, that right one shot right up. That left one didn't come up as much. Let me just check, and you start kind of feeling around in your neck, and sure enough, you're like, whoa, there's some major restriction right
Yeah.
there. Kind of wiggle, just kind of wiggle that out a little bit. Do it again. It's like, whoa, now those deep muscles that nobody ever remembers the name of, those little muscles down there, they can
Yeah.
actually pull like they're supposed to. And so those are some of like the objective things. And then
Yeah.
it's all just a feel,
Yeah.
like, how do you feel? Like, man, I feel terrible.
Yeah.
Well, there you go, man. Like, you shouldn't feel terrible.
Right. Right. Yeah. That's not the normal objective or ideal human experience. Is not. I felt terrible. At least not like in like the general sense. There's certainly times you're like, I mean, I'm happy, but God, my body hurts. Like,
Right. Yeah. No, I
hard
mean,
workout, but I'm sore as crap, but I'm pretty happy.
yeah, when you're just when you just are worn out,
Yeah.
that's the thing. That's probably maybe a better way to describe it. Like, man, are you just worn out? I mean, sometimes you get to the end of your work week,
Yep.
and it's like, man, it's been meeting after meeting after meeting, or man, we lost two people this week. I'm doing, and you're like, dude,
Yep.
I'm just worn out. Like,
Yep.
that's different than fatigue. Like
Yep.
you're saying, hey, I had a hard workout. We went on a big hike or what, something like that. And you're like, oh, I'm tired.
Yep.
Tired and worn out are two different things.
Yep.
So again, it's like, oh,
Yeah, I think that's helpful for especially people who are new to exercise and people who have been doing it for a while. It's like learning to take a self-analysis and like, is what am I experiencing like like muscular fatigue?
right,
It's like, it's just kind of, oh my goodness, we did so many reps the other day. Or is it like this neurological, just like, there's a difference between like, man, I really don't want to do more upper body today because my upper
yeah,
body's tired versus like, I don't want to do anything today. I'm so tired. Like the very thought of doing anything exhausts me even more.
right. And that runs you down the whole conversation of like burnout, and especially when you're talking about kids and athletics and stuff like that. Man, that's Man, are they worn out? They've lost interest in things, all, the standard stuff with burnout, all the symptoms. They lost the interest in things they normally like. Their appetite's messed up or whatever it may be.
Yeah, for me, like my big triggers for like being like worn out, overtrained, just neurologically shot is food. If I
Mhm.
am not hungry, then I'm like, oop, something's totally off. And then my sleep gets wonky. If I
Yep.
can't, I'm typically, my sleep is almost 100% of the time like super regulated. I fall asleep on almost immediately. I stay asleep for 8 hours, like, and it's pretty regulated. But if it's like I can't fall asleep, or I find myself waking up like more than once, maybe to go pee,
Yep.
I'm like, something's up. And typically for me, and the reality for me is that when I'm in that situation, I have to go, okay, well, I can't adjust my work much, so I'm gonna have to adjust my workouts a bit.
Right.
What are your maybe recommendations around adjusting workouts if you're in like some just deep stress?
Well, definitely you got to unload somehow.
Yeah.
There's some kind of load management has to happen. You know, Sometimes it's tough if you're like really, really training, and you're like, oh, I got my percentages. Those are the athletes that are really, really tough to deal with when it comes to all this stuff because it is like, man, I can't. I'm scheduled to hit this. I got to hit it. Well, the bottom line is like, no, we're just going to kill yourself if you do that. So there has to be some kind of a wiggle room. So it's almost like it's the idea of grace, right? Like we got to give ourselves a little bit of grace, you
Yeah.
know. And so when it comes to nervous system regulation, vagal tone regulation, is you got to almost come to grips with the idea of grace. Give yourself a little bit of slack. It's okay, and listen to what your vagus nerve is saying. Your body's telling you what it needs. Are
Yeah.
you smart enough to kind of listen? And are you maybe humble enough to actually give it what it's asking for?
Yeah.
You
Yeah. For me, the way I kind of like think through it is, okay, is today the only day I can do this?
Right,
Like, would it just be better for me to like take the day off or maybe just go for a walk or do some light workout? Like, I can hit the heavy one tomorrow.
right,
And if the answer is like, yeah, then typically I'll be like, all right, just hit it tomorrow. But if it's like I have to do it today, for me personally, I can handle intensity, but I can't handle volume.
right,
So like if it was, let's say it was 90% for 3 sets of 3 or 4, something like that, I might be like, I'll do 3 sets of one. I hit the
right.
intensity, I can hit the same weight, but I'll just do sets of one. And that
Yeah,
seems to be like enough for me to like get it in, check the box. Yeah, I'm not getting the full recovery as I might need, but like maybe there's other ways I can adjust for that. But it's also not sending me deeper into the hole.
right. Yeah, and that's what that's where it's really good to have a coach. You know what I mean? Sometimes you're doing it by yourself. You just, maybe it's an online thing or whatever. It's really good to have a coach there to kind of help you walk through that, of how do you adjust that? Like you said, there's 1,000 ways to skin that cat. Is it adjust the volume? Is it adjust the intensity? Is it adjust the speed? Like the nervous system, speed kills the nervous system. Anytime you start introducing velocity into that nervous system gets smoked.
Yep.
So if it's like, hey, we got velocity-based training today, and it's like, no, we don't, just like maybe we go to isometric holds, you know what I mean? It's like there's 1,000 different ways to skin it. Maybe you don't need to do a lift at all. Maybe you need to go walk outside in the sunshine.
Yeah.
So uh, again, it's just being comfortable with, like you said, maybe I'm going to push this lift to tomorrow. One of the things that when you're feeling run down, and this is again one of those kind of silly sounding things, is you need to do something that makes you happy.
Yeah.
It's really, again, it sounds so simple and kind of silly, but it's like, I don't like to deadlift. I'm feeling run down. Well, don't deadlift. What do you like to do? Like,
Yeah.
man, I like to get a bro pump. okay, if you're feeling
Yeah.
run down, maybe you shift in and get you a bro pump, or maybe you like to do more movement-based stuff. Maybe you like, I don't know, whatever. Do something that you actually enjoy doing.
Yeah.
And you're gonna see, you're gonna get a ton more dopamine off of that. You're gonna get, you're gonna get all sorts of good stuff and
And
shoot to a happy zone.
it requires less of a sympathetic ramp up.
Right.
It's
That's it.
like if you like really hate deadlifting, like you gotta get yourself psyched up to deadlift. But if you're
Yeah.
like, I could walk all day, listen to podcasts. Like, well, yeah, I can walk all day, walk and do a podcast because it doesn't require any like sympathetic ramping.
Right. Again, it sounds really, really silly, but it is. Maybe you just need to chill and go get something to eat with your boys or whatever. But like you said,
Well,
I
I
think
think.
go ahead.
Well, I was gonna say, like, I think there's part of the there's maybe two types of people when we'll say maybe it's two types of people when it comes to like training.
Hmm.
There's the people you gotta push and the people you gotta pull.
Right, right. Yes.
People you're like, hey, I don't care. Like you're gonna have to do it today.
Yep.
And then and those are the typically like you're gonna know who you are. And so if you're the type of person who's like needs to be pushed, then you probably need to be pushed. If the person's like, yeah, you gotta be pulled back a little bit. Those are the people who really need like those like take a take a day off, man. The driven individual is not going to be excited about taking a day off, and typically those are people who need the day off because you go, hey, dude, you're going to work out for the next 80 years.
Right. We got time.
A day off is going to be a heck of a lot better than a month off because you pull a pec or something because you were
Right.
a dum dum.
Yeah. And I think it helps too. Once we start kind of looking at your body as this whole system, we're looking at the nervous system, how it drives everything, instead of just looking at the body from a musculoskeletal look, view. And that's kind of what we typically do.
Yep.
I have strong bones, strong muscles. All right. Well, there's this whole other complex system that needs to be working. And
Yep.
once we start looking at, I think, a little bit more holistically and get our athletes and our patients to understand that's a challenge to get them to
Yep.
kind of, it's weird. You start talking about all this, sound, oh, this sounds a little bit weird or whatever. And start getting them to understand that we're improving the entire system, right? We're just not getting strong here.
Yep.
Right? Because you can have all the strength in the world, but if you don't have the neural drive to utilize that strength, then you might as well not even have it.
Yep.
Especially when it comes to like traditional athletes, not your strength athletes. You're talking about your soccer players, your basketball players, football players, those guys. Like, yes, they want to be strong or whatever, but the bottom line is I need your system as a whole, specifically the nervous system, to be optimized to utilize every aspect of your musculoskeletal system.
Yep.
If you kind of can get them to remotely understand that and bridge that, then when you do have to have a day off, oh, it's not the end of the world.
Yep. Yeah,
That's
for
a
sure.
hard thing to do, though.
It is. It is. Brad, man, I really appreciate this conversation. It was very insightful, and I think a lot of people will appreciate it. Where can people get in touch with you?
So I work at Excel Performance and Wellness. We're a branch of Campbell Clinic, actually. So we do strength and conditioning, working with athletes, working with regular people. And of course, I'm doing physical therapy there too. So you just look us up on Instagram and all the stuff. But Excel, ACCEL, Performance and Wellness. And so that's where I am during the day. And come out, check us out. And if you need me, that's where I'm at.
Awesome. All right, Brad, thanks so much for coming on MBS Fitness Radio.
Yes, sir.
Thank you for listening to NBS Fitness Radio. If you enjoyed the podcast, be sure to share it with your friends, follow us on social media, and check out our website at www.nbsfitness.net. Hit the subscribe button and tune in next time for more NBS Fitness Radio.